The next paper is on utility of ultrasound as a screening tool in precocious puberty. Dr. Meenu J.
A hearty good morning to respected judges, delegates, and my dear friends. Today I am here to present the results of my study, Efficacy of Ultrasound Abdomen as a Diagnostic Modality in Girls with Precocious Puberty. Early maturation in girls is the development of secondary sexual characters before 8 years of age. This may be seen in precocious puberty or premature thelarche. Premature thelarche is the breast development in a girl less than 8 years and it is a non-progressive condition, whereas precocious puberty being a progressive disorder may lead to early menarche or compromised final height. Hence, it is often a diagnostic dilemma and cumbersome GnRH analog testing is often required to differentiate precocious puberty from simple thelarche. A robust screening tool will help pediatricians rationalize these investigations in a girl with thelarche. Also, there is positive data from India on diagnostic efficacy of ultrasound abdomen. Hence, we decided to conduct this study with the aim to assess the utility of uterine size on ultrasound pelvis as a screening tool for evaluating precocious puberty in girls presenting with early thelarche. The research question in our mind was, can uterine size on ultrasound pelvis help us to differentiate a pathological condition like precocious puberty from its simple variant of premature thelarche? We conducted a prospective observational study from January 2019 to December 2022, and our target population were girls who presented to the endocrine clinic of a tertiary care center with features of precocious puberty. Inclusion criteria were girls with onset of thelarche less than 8 years. We excluded those with peripheral precocious puberty and children with hypothyroidism and those who did not give consent. Ultrasonography was performed using high-resolution, real-time logic SAGE healthcare machine with 1 to 6 MHz convex transducer. All ultrasound scans were done trans-abdominally with a full bladder by a single pediatric radiologist who was blinded from history as well as physical examination findings. The uterine length was measured from the base of the cervix to the apex of the fundus. Apart from uterine length, we measured the fundocervical ratio and the ovarian volume. For each parameter, the mean of 3 consecutive values was taken and considered to be final. We calculated the sample size based on a preset formula and we obtained a sample size of 82 subjects. Statistical analysis was done by chi-square test to compare the categorical values and student t-test to compare continuous variables among the two study groups. A p-value less than 0.05 was considered to be significant. SPSS software was used for analysis and ROC curve was used to identify the optimal cutoff of uterine length. Ethical consideration was obtained from the hospital ethics committee and a written consent was obtained from the parents and guardian of children. Those who were diagnosed to have simple thelarche, they were regularly followed up. Their height, weight, as well as SMR staging was done periodically and red flag signs were clearly explained to the parents. In those with central precocious puberty, MRI brain was done and they were diagnosed to have neurogenic central precocious puberty. Neurosurgeon opinion was obtained. In those with idiopathic central precocious puberty, GnRH analog treatment was started. In a third group where we could not reach a diagnosis even after doing baseline assessment, GnRH stimulation test was done as per protocol. One more slide was there, it was not displayed due to a technical error. Apart from the ultrasonography, other parameters like anthropometry, height, weight, BMI and pubertal staging using the Tanner stage and biochemical parameters like the LH, FSH, estradiol and GnRH stimulation test was performed by injecting 10 to 20 microgram of leuprolide subcutaneously and samples were taken at 0, 4 and 24 hours. And radiological parameters like bone age, uterine length, ovarian volume from ultrasound and MRI brain for those with central precocious puberty was done. Moving on to results. From the results we found out that from the radiological parameters, the uterine length and ovarian volume and from the biochemical parameters, the LH, FSH and estradiol were statistically significant with a p-value less than 0.05. And those with central precocious puberty, MRI changes were there in 8 children. And most of them had Tanner stage 2 or 3. And those with central precocious puberty, 54 of them received treatment and 9 of them did not receive treatment. So, a uterine length of 4 plus or minus 0.8 in central precocious puberty group versus 2.7 plus or minus 0.5 centimeters in simple thelarche was found to be statistically significant with p-value less than 0.05. So using the ROC curve, we were able to obtain a cutoff of 3.05 centimeter, was able to distinguish between precocious puberty and simple TLRK with a sensitivity of 85% and specificity of 82%, and the area under the curve being 0.9. So in those with central precocious puberty who had MRI changes, that is 8 children, all of them had a uterine length greater than 3.05. Hence, by doing a simple ultrasound, we were able to pick up those with MRI changes, and no children required sedation while doing ultrasound abdomen. So the strength of the study was that it is a prospective 3-year study with a robust sample size. And the limitation was that a small number of girls, that is n is equal to 5, who had simple TLRK could not be followed up due to logistic reasons. So what is already known to us is that the assessment of uterine length on ultrasound is a part of evaluation of girls with early TLRK to ascertain the estrogenic activity. What this study adds is a uterine length greater than 3.05 centimeter may be a useful age independent cutoff to identify girls with central precocious puberty. So this is a study which is conducted in different parts of the world. In most of them, it is said that the uterine length is one of the best parameters to differentiate between central precocious puberty and premature TLRK. That is what our study also says. So USG being a sensitive, easily available and cost-effective screening tool for identifying precocious puberty, we recommend that this study may be validated to a larger population. Thank you. Sorry sir, one more flowchart was there which could not be displayed. We had 101 children who presented to our clinic with simple TLRK. Out of them, 12 did not satisfy the inclusion criteria because some of them had, 3 of them had hypothyroidism, 3 had central precocious puberty and 3 did not give consent. So we had 89 children who were satisfying the inclusion criteria. Out of this, in all of them, we did the baseline assessment, that is the clinical, radiological as well as the biochemical parameters, and we found out that 24 of them were diagnosed to have simple TLRK and 36 had central precocious puberty. And in the third group where we had a diagnostic dilemma, we performed the GnRH stimulation test as per the hospital protocol, and we found out that 6 of them turned out to be simple TLRK and 24 had central precocious puberty. In those with simple TLRK, we followed up them regularly. Their height, weight, BMI and as well as pubertal staging was done every 3 monthly, and red flag signs were explained to the parents. However, 5 of them did not follow up, and out of this simple TLRK, 21 did not develop any red flag signs. However, 4 of them progressed to central precocious puberty, and in those with central precocious puberty, all of them underwent MRI brain and GnRH analog treatment was initiated. Thank you, sir.
So, of course, it's very important to find out the effect of precocious puberty. Naturally, it only will have effect on uterus. So, isn't it? So, what is the reason why you have undertaken this study? You have mentioned aims because it's known that to differentiate central precocious puberty, uterine size is very important. And already studies have been done. So what is novel about your study? No. See, central precocious puberty is stimulation from the center. Naturally, it will have its effect on uterus, etc. So what is the importance of this study? Because though you have mentioned it, you have to make it much more clear because already 4 studies are there. Yeah. Yeah, it's very important because, of course, it's an important organ which will have its effect, So naturally, it's important. It's a good study. Of course, only thing, when compared to this thing, you are very fast and this thing. I don't know whether it is my age. No, you have to be slow and this thing. You are too fast, like an express train, just whizzing away. Otherwise, your presentation was good. Okay.
What are the challenges you faced? Because you should have convinced the parents, like to go for a test in addition to. So, what are the challenges you faced?
The challenges were mainly following up them. For those with simple TLRK, we had to ask them to come for review every 3 monthly. some of them are not willing. Another one is convincing them regarding GnRH analog treatment for those who had central precocious puberty. Many were hypothetical about the side effects, increase in BMI, like that, sir.
Nice presentation. Pretty confident. I think you could tell the results without even seeing the, slides. That's good. Yeah, as sir asked, what was the challenges to convince, because early Tilarki, a lot of them do have now. A lot of children are now obese, they have less physical activity. So to convince them that, this could be simple or precocious itself would have taken your efforts. And ultrasound is not there in the protocol before.
It is there, ma'am, but for diagnosis, we are telling that if instead of doing this invasive GnRH stimulation test, which is also difficult to convince because we had to take 3 blood samples, this ultrasound will help to differentiate between.
Instead of doing the GnRH test. Okay. So only if you have a doubt in that, then you go for a
yes, ma'am. Along with other LH basal LH value, estradiol, bone age.
Okay.
So we appreciate. Only thing, of course, we want more students to attend, and so that they will have. Just now I was mentioning the beginning, this city forum, etc., which are giving exposure to students to present cases, have made presentation very good within the allotted time, and of course the confidence level also has gone up because of the city forum case presentations in various parts of India. So we were very happy that the standard of presentation has been good. Only thing, a few more people should attend it. Only 3 candidates was a little disappointment. Okay, but anyhow, enjoyed it. Yes, totally. Yeah, I know that this thing. So only for the time limit, they are only limited to 3. Thank you. Yeah.
Thank you, Dr. Meenu, and thank you, judges. We would like to state that we had received 27 papers for the competition, for the award paper, and we had shortlisted 3 out of the 27, and the rest have been converted into posters. I heartfelt thanks to the most esteemed judges for judging today's paper presentation. Thank you, sirs, and thank you, ma'am.